Hello and welcome to our webinar, Iodine and Autoimmune Thyroid Disorders, presented by Dr. David Braunstin and hosted by Power to Practice, the first EMR, practice management, and patient portal software designed for integrative medicine. Dr. David Braunstin is a board-certified family physician and is one of the foremost practitioners of holistic medicine. He is the medical director of the Center for Holistic Medicine in West Bloomfield, Michigan. Dr. Braunstin has lectured internationally to physicians and others about his success in using natural hormones and nutrition therapies in practice. He is a graduate of the University of Michigan and Wayne State University School of Medicine. Dr. Braunstin is a member of the American Academy of Family Physicians and the International College of Integrative Medicine, where he is on the board of directors. He is the father of two medical students, Haley and Jessica, and is a retired soccer coach. Dr. Braunstin has received two prestigious awards by his colleagues. The first was given by the American College for the Advancement in Medicine at the 2005 annual meeting. The award was the Norman E. Clark Senior Award for Science and Practice. The second award was given by the American Academy of Integrative Medicine at their 2005 annual meeting in Florida. This award was titled 2005 ARC Excellence Award for Distinguished Clinician and was given for his advancements in the diagnosis and treatment of chronic diseases. He has authored 14 books, 11 of which are national bestsellers, and he is the author of the national newsletter, Dr. Braunstein's Natural Way to Health. And with that, I will hand the presentation over to Dr. Braunstin so we can get started. Welcome, Dr. Braunstin.
Thank you, Linda. I'm happy to be here, and thank you all for taking time out of your Thursday evening, if you're on East Coast time, to be here. And we will talk about a topic that I like talking about. It's autoimmune thyroid disorders, because there's so much misinformation about how to treat this holistically, and I will cover that in this next hour. So I'd like to start with a quote, and I'm sure all of you know where this quote came from. This quote says, "This lecture will be given with an enthusiasm unknown to mankind." And of course, this quote comes from the coach, Jim Harbaugh, the coach of the most winning college football team in the history of college football, the University of Michigan Wolverines. Didn't have quite the year I wanted them to have this year. You know, we won 10 games, finished number 10 in the country. We actually won 11 games, but the officials in Columbus decided that they didn't want that to happen. But that's another story. So let's come back to the topic of discussion, which is the autoimmune thyroid disorders. And the conventional thoughts on autoimmune thyroid disorders are, don't take iodine because it will cause or worsen autoimmune thyroid disorders, and don't take desiccated thyroid because it will do the same thing. Well, those two statements can be easily debunked, and when I think about those two statements, I think about those commercials from the 70s with Cora, saying, "Where's the beef?" And where's the beef behind those statements? And there really is no truth behind those statements. So number one, don't take iodine because it will cause or worsen autoimmune thyroid disorders. Well, autoimmune thyroid disorders cannot be experimentally induced without using a goitrogen or ensuring iodine deficiency. And don't take desiccated thyroid, because it will do the same thing, is just not true, because desiccated thyroid hormone has never been shown to cause autoimmune thyroid disorders. So those are myths that are out there and still widely written about in the holistic world, and they're just not true. These are some of the books that I've written. I write about what works in my practice, and we'll discuss iodine and its treatment of autoimmune thyroid disorders because that works in my practice. This is my book, Iodine, Why You Need It, Why You Can't Live Without It. It's in its 5th edition. And there's two common illnesses we will dispose of, hopefully, in the next hour: medical iodophobia and medical desiccated thyroidophobia. So let me just give you a quick intro on iodine. There's approximately 1.5 to 2 grams of iodine stored in the body at sufficiency. The fat tissue stores the most, the muscle second, and you can see the thyroid for comparison. Now, the thyroid may have the highest concentration of iodine, but it certainly doesn't have the most amount of iodine, compared to those other tissues. But it's good to keep in mind that every organ and every tissue contains iodine. In fact, every cell needs iodine to function optimally. So it's also important to know that iodine is present in every cell in the body, that many different glands and cells concentrate iodine against a gradient, and this is done by the transporter, which is a sodium iodine symporter. I'm going to explain that in a little more detail. That's like a little taxi cab that moves iodine from the bloodstream into the cell. And it transports iodine at a concentration gradient 20 to 50 times that of plasma, meaning that it must be an active transport because you're transporting it from a high to low area across the cell membrane. So this sodium iodine symporter works by moving one atom of iodine along with 2 atoms of sodium in the same direction, while burning an ATP to do that. So these next few slides took about 10 years to work through and go through many different articles and put this mechanism together. But the sodium iodine symporter is shown there in the orange or yellowish box, and iodide in the bloodstream is shown on the outside of the cell membrane. So what's important to keep in mind is the symporter is stimulated by TSH. So one of the first things that happens when someone takes iodine is if someone's checking blood work, after they start iodine, they'll see the TSH creep up. And the TSH can creep up usually into the maybe 6 to 10 range. And mistakenly, somebody will look at that and say, we're making them hypothyroid by giving them an iodine. No, you're not. You're doing an appropriate response of the TSH to stimulate more symporters to be produced. The human body is doesn't have sodium iodine symporters sitting there waiting to move iodine across the cell membrane when there's no iodine. It just doesn't make them. So it has to have a stimulating mechanism, and that stimulating mechanism is TSH. So when there's iodine that needs to move into the cell membrane, TSH stimulates that symporter, and iodide is moved across the cell membrane. The first step that happens is it has to undergo oxidation via hydrogen peroxide and thyroperoxidase to form iodine. Iodine is the oxidized form of iodide. So iodine has to next undergo organification and be bound with thyroglobulin to make thyroid hormone. And you can see the end result here is T1, T2, T3, and T4. And the numbers referring to how many iodine atoms are attached to that thyroglobulin molecule. That's the nuts and bolts of how that system works. Now, that's the RDA for iodine, as you can see on the right. But on the left, I just clicked an arrow down that says at 100 times the RDA for iodine, you can form iodinated lipids, such as delta iodolactone and other iodinated lipids. Keep in mind, these iodinated lipids will not be formed at the RDA for iodine, which is 150 micrograms per day. So, iodolactone is the most prominent iodolipid produced in the thyroid and the breast tissue. Here's the formula for it, and you can see thyroperoxidase is the enzyme that catalyzes that reaction using arachidonic acid. Delta iodolactone is a key regulator of apoptosis and cellular proliferation in the thyroid. It inhibits epidermal growth factor from thyroid follicles. Delta iodolactone is not detected in human tissue when iodine deficiency is present, but is present with iodine administration at 100 times the RDA for iodine. Now, MNU is frequently utilized to produce tumors in glandular tissue, in particular the thyroid. And MNU-induced tumors are found to contain 4 times more arachidonic acid than normal mammary glands. And iodine supplementation is accompanied by a 10-fold higher delta iodolactone content in tumors. Now, we want delta iodolactone there because it has apoptotic effects for cancer cells. The same research shows, and I just stated it, that delta iodolactone and iodine have anti-proliferative and apoptotic properties. So where does iodine regulate the cell cycle? It regulates it at, oops, I'm sorry, what? It regulates it here and here, G0 and G2 of the cell cycle. So here's what we just went through. We're making thyroid hormone at the RDA for iodine. We can make this iodinated lipid at 100 times the RDA for iodine. But where does H2O2 come from? Well, H2O2 is locally supplied by the NADPH oxidase system. It's oxidative phosphorylation, and there's a brake and there's an acceleration on this pathway. And the brake is iodinated lipids, and the acceleration, can be stimulated with calcium. So the body, just like it has, many checks and balances for other systems, has a checks and balance system here, so things don't get out of control. So now let's look at what's going on across the United States with too low of iodine levels. My partners and I have checked now over 7,000 patients, and we have found over 97% low in iodine, most significantly low in iodine. I've talked to practitioners across the country. They're seeing the same things that I'm seeing. So if you look at the government's own NHANES data, iodine deficiency is alive and well in our 21st century, as most of us are iodine deficient as well. So we're back here to the beginning of our slide. Sodium iodine symporter, the taxi cap that moves iodide across the cell membrane to eventually make thyroid hormone. But now we don't have enough iodine in the body. So we got decreased amounts of iodine. You're still going to make thyroid hormone through the same mechanism that we went through. And in this case, if you start looking closely at the labs, you'll see T3 a little bit higher in the reference range and T4 a little bit lower in the reference range. That should not be happening because T4 is supposed to convert into T3. But that's what you'll see, and I saw this for years before I understood how this mechanism worked. Now, are you going to form delta-iodolactone at decreasing iodine amounts? If you recall, I said you need 100 times the RDA for iodine to form delta-iodolactone. So that's not going to happen. And if we go here to the oxidative phosphorylation system, are we going to have the brake on this pathway? The answer is no. We're not forming delta-iodolactone or other iodinated lipids. But the stimulatory pathway is still going. This can lead to an increased local production of hydrogen peroxide, which can damage TPO and start an oxidative problem in the thyroid. And TPO is a very reactive molecule. It's very damaging when it gets oxidized. And it's basically can start the oxidative fires of autoimmune disorder. So what does the body do to counter this? Well, it makes antithyroid peroxidase antibodies and antithyroglobulin antibodies. This is Hashimoto's or Graves' disease. This is the mechanism of autoimmune thyroid disorders. In fact, I think it's a similar mechanism is occurring in other tissues for autoimmune disorders as well. So what's the treatment for this? Well, if you look at this treatment from the beginning, you can see the first thing is you're going to need more iodine to make more iodinated lipids. But you could also use perhaps a little magnesium to counter the excess calcium. You've got this oxidative fire burning from peroxide damaging thyroperoxidase, and the body trying to put it out with antithyroperoxidase antibodies. So you could give them an antioxidant. And there's things to use, and the treatment for it is shown here: iodine and magnesium. Vitamins B2 and B3 help settle down this NADPH oxidase system, since these are the rate-limiting vitamins for that system. Selenium is an intracellular antioxidant if it's low. Vitamin C I mentioned, as well as other antioxidants. This is a holistic way of how to diagnose and treat an autoimmune problem. So, how much iodine should you take? Well, I say when there is iodine sufficiency, there is little or no radioactive iodine uptake by the thyroid gland. How much iodine is required to achieve sufficiency? Well, there was a series of studies done in the 1960s with captive medical students where they were given varying doses of iodine, and they found that the absorption of radioactive iodine into the thyroid declined from a normal of about 12 to 32%. In this case, 3 to 5 milligrams to below 5%, just as you would expect. To give more iodine, you're going to have less radioactive iodine uptake by the thyroid. Sternthal gave some captive medical students varying amounts of iodine and found that the radioactive uptake by iodine went down, just as you would expect. My mentor in iodine, Dr. Guy Abraham, should have got a Nobel Prize for this graph, because this explains the whole nutshell to you. As you increase the daily iodine uptake on logarithmic scale, the 24-hour radioactive iodine uptake by the thyroid goes down, just as I just showed you. On the z-axis, the amount retained by the thyroid goes up as you take more iodine to a maximum of 600 micrograms per day. So the question is, where do you want to be on this graph? How much iodine do you want to take? Here's the RDA for iodine, somewhere right about here. I say you want to be here. You want to maximize thyroid uptake of iodine, and you want to minimize radioactive iodine uptake by the thyroid, which means that your thyroid gland has been saturated with iodine. It's more than 10 milligrams. Here's 50 milligrams. Here's 100 milligrams. Somewhere in these milligram amounts, these are, This is almost 100 times the RDA for iodine is right about here. So the RDA is inadequate to supply the body's need. The dose must be individualized and use a combination of iodine and iodide to get the best whole body effect. But you should do the appropriate pre and post testing. And my experience is for autoimmune thyroid disorders, the doses generally range from 6 to 50 milligrams per day. So keep in mind, T4 contains 4 atoms of iodine, T3 contains 3, and without sufficient iodine, the thyroid is unable to make thyroid hormones. The thyroid tissue will become hyperplastic in a state of iodine deficiency, which is the precursor to autoimmune thyroid illness. So autoimmune thyroid illness is shown here. This is my daughter Haley, who's a first-year med student, and this is, when we beat Ohio State at the Big House, and of course everybody knows we beat them in Columbus this year until the officials decided that when you stop them on 4th and 1 that they have to give them a first down or they'll get kicked out of Columbus or hurt or something. But besides that, Haley was diagnosed with autoimmune thyroid disorders, with Hashimoto's disease at age 12. You can see here's her age up here and her thyroid antibodies. She was having headaches and fatigue. And it was my wife who actually diagnosed her, who said at dinner one time, hey, do you think the girls could have a thyroid problem? Because they were tired and complaining of headaches all the time. And I was like, slapping my head at that time like a V8 commercial. Since I treated all day, of course I couldn't see it in my kids. I had my wife tell me what they had. So here's Haley's initial blood work. Her TSH was 5.1. I treated her with nature thyroid, a half a grain. That's desiccated thyroid, and put her on 25 milligrams of iodine because she had a loading test, which was low, which I didn't show you here. So Haley was also told to go on a gluten-free diet because she had gluten antibodies, and a dairy-free diet because she had casein antibodies, which Haley followed pretty well. This was a follow-up for Haley at age 15. She's showing she had these antibodies peak out at these levels, so they're starting to come down here. She didn't really follow her diet the first 2.5 years as a young teen wouldn't do, and she still wasn't feeling great. And then she really decided to pick up her diet right around here. So at this point, I upped her nature thyroid to 1 grain and upped her iodine of 12.5 milligrams to 37.5 milligrams per day. This is 100, 200, it's about 300 times the RDA for iodine. Here's Haley at 16 following her diet, and you can see her thyroid levels have normalized, her antibodies are gone. She no longer has Hashimoto's disease here. And here's Haley at 16, antibody levels not detectable, still making adjustments in her thyroid hormone a little bit, still making adjustments in iodine based on her blood work here. And here's the latest blood work on Haley, which we just got at Christmas break. And, basically, she doesn't really, I know that's a little just above the reference range, but thyroid antibodies staying significantly lowered. And, I'm happy to say to her she doesn't really have any signs of Hashimoto's anymore, no headaches, she's feeling good. So this is an N of 1 where patient treated with desiccated thyroid and iodine basically cured their Hashimoto's disease. And between my partners and I, we have way more than an N of 1, and we do this on a daily basis. So I say both claims above as causing autoimmune thyroid disorders are examples of medical iodo and desiccated thyroidophobias. They're just not true. And unfortunately, these myths are still perpetuated by many holistic doctors, and I see the writings today, and trust me, I hear about it when it's written about. And either I've got different patients than everybody, than others out there, or I've got something that works, and I don't see why my method wouldn't work anywhere. So, from 1971 to 2012, over 40 years, the NHANES data, that's the government's own National Health and Nutrition Examination Survey, showed that iodine levels have declined by 50% across the United States, and it's shown here. So, keep in mind that association does not equal causation. So, just because iodine levels have fallen, doesn't necessarily mean, anything related to the thyroid. But a negative association disproves causation. So if we go back here, iodine levels falling and autoimmune thyroid disorders going up during this time period is a negative association. That means iodine does not cause autoimmune thyroid disorders, period. Now, I'll get into some of the issues with iodine and that, but it doesn't. Mark Twain said it's easier to fool people than to convince them that they are fooled. And, I know this statement's been repeated over and over that iodine causes autoimmune thyroid disorders, but it doesn't make it true. So, I mean, you still might ask the question, as I did here, are autoimmune thyroid illnesses caused by iodine deficiency? 2 areas of Denmark were studied due to differences in iodine intake. These were all adults. In Aalborg, this was the median iodine excretion, which puts them, near severely iodine deficient. Copenhagen, a little bit higher. These are classified as moderately iodine deficient. So they're both low in iodine, but you would expect if iodine was causing autoimmune thyroid disorders that the ones who are lower would have less autoimmune thyroid disorders, and that's just the opposite of what you see here. Aalborg has 2.6-fold higher autoimmune thyroid disorders compared to Copenhagen. Just the opposite. So minor differences in iodine excretion can produce large increases in thyroid disorders. What are we seeing epidemics of now? We're seeing epidemics of thyroid disorders, particularly autoimmune thyroid disorders. And the biggest research studies that I could point out that iodine doesn't cause autoimmune thyroid disorders occur with X-ray fluorescence scanning. That can measure the stable iodine content of the thyroid gland. It used to be done. You can't get it anywhere. I don't think you get it anywhere in the United States right now. Some countries still do it. However, when this study was brought out in 1979, they said there was a mean value of 10 milligrams of iodine per thyroid gland in the normal population. Well, we know the thyroid can hold about 50 milligrams at saturation. That means the mean value of people are iodine deficient. I mean, if we have the iodine receptors in the thyroid, I assume that's because they should be iodinated. 56 subjects with autoimmune thyroid disorders had a mean value half that of 4.7 milligrams of iodine per thyroid. If iodine were causing this, you would expect just the opposite to occur. 13 subjects with autoimmune thyroiditis and hypothyroidism had a mean value of 2.3 milligrams, 4-fold lower. If iodine were the cause of autoimmune thyroid disorders, you would expect more iodine in the infected gland, not less. So the lowest concentration of iodine in thyroid was found in thyroid cancer. 75% of patients studied at less than 20 micrograms per gram on scanning. I talk about the iodine deficiency continuum. One of iodine's main jobs in the body is in all the endocrine tissue, the thyroid, the ovaries, the uterus, the breast, the prostate, the pancreas, to maintain the normal architecture of that tissue. In iodine deficiency, the first thing that happens is you get cysts in those tissue. If iodine deficiency goes on, those cysts become hard and nodular. Over time, they can become hyperplastic, which can lead to with cancer in all those tissues. The neat thing about iodine is in humans, animals, and test tubes, iodine replacement has been shown to reverse this continuum at any point that it catches it and to stop the further progression of it. So this was a study batted around, and I saw this from some of the holistic guys who don't agree with me, and they said it's another example of iodine causing autoimmune thyroiditis. And the results of this study was that potassium iodide in a solution of 30 millimolars and higher were found to inhibit the normal growth curve of thyroid cells. They arrested the cell cycle, where I showed you there, G0 and G2, and it did not induce apoptosis or necrosis of thyroid cells. So the authors of this study, from Thyroid, the journal for thyroid, said this study showed that iodine excess inhibited human primary thyroid proliferation in the presence of low-dose interferon. Potassium iodide could induce lymphocytic infiltration in the thyroid gland, which is Hashimoto's disease, and secretion of pro-inflammatory cytokines, creating inflammation. This could explain the development of hypothyroidism after adding iodine in a diet of persons that already have lymphocytic infiltration and or mild inflammation of the thyroid gland. This was trotted out as another study showing iodine causes autoimmune thyroid disorders. So it says here 30 millimolars and higher of iodine. How much iodine do you need to get to 30 millimolars? Well, of course they don't tell you that in the study, and you got to calculate it, and you got to use your inorganic chemistry formulas to do this. And after I got the rust out of my brain, and it took me a while, and it took me some help from my daughters, who were closer to inorganic chemistry than I was, I went through the study, and these were the levels that they looked at: 10 micromolars to 100 millimolars of potassium iodide. So how much iodine do you need to ingest to achieve these levels? Well, we know the molecular weight of iodine is 127 milligrams per liter. We know the renal clearance of iodine is about 42.5 liters per day. So if we just do our formulas like we used to be good at, we come up with 6,000 milligrams, 5,000 milligrams per day is 1 millimolar of potassium iodide. So if we go fill in our blanks, here's a filling in our blanks. Here's what they reported is causing the problems. 30 millimolars. So I would advise all of you listening to not take or have your patients take 161,000 milligrams of iodine per day. So the conclusion of the article was normal human thyroid cell proliferation is inhibited in a dose-dependent manner by iodine concentrations over 10 millimolars. Remember, that's 161 grams of iodine per day. I say this is a perfect example of medical iodophobia. They read the study wrong. They reported the study incorrectly. And people who just read the conclusions or don't understand it, just parroted it. So the real conclusion was iodine doses up to 161 grams per day do not cause changes in normal human thyroid cell proliferation. Iodine is not associated with autoimmune thyroid illness unless it was given in large doses over 161 grams per day, along with a goitrogen such as interferon. That's the real conclusion of this study. Of course, I'm not talking about using 161 grams per day. I'm talking about using somewhere between 12 to 50 milligrams per day for most people. In vitro studies with purified fractions of calf thyroid glands showed that a 10 to the minus fifth molar iodine concentration protects TPO against oxidative damage. That's your protection against autoimmune thyroid disorders and damage in the thyroid tissue and Graves' disease as well. To achieve a 10 to the minus fifth molar iodine, a human adult needs to take in 50 to 100 milligrams of iodine per day. This 10 to the minus fifth molar iodine cannot be achieved at less than 50 milligrams of iodine per day. So this is Alex. He's a patient of mine. Alex was 16 years old, brought in, I was seeing his mother, and he's got a goiter, and the endocrinologist told him, he had been seeing the endocrinologist for 4 years and said, you got to have surgery and have that thyroid out. The mother didn't want the thyroid out. So Alex was also diagnosed, around 13 years old with Hashimoto's disease. And the endocrinologist, I'm sorry, he didn't want to have his thyroid out. He wanted to irradiate the thyroid with radioactive iodine. So his original iodine levels were below detectable levels in a spot urinary iodine. They were just read as below the lowest level. His iodine loading test showed a 20% excretion when normal is over 90%. His thyroid numbers showed that he was euthyroid upon initial testing, although he did have high antibody titers. He had normal selenium levels in RBC and hair testing. So I treated Alex with unrefined salt since he was found to be salt deficient on his blood work, vitamin C, iodine, magnesium, and a multivitamin mineral product. And I gave him 50 milligrams of iodine per day based on his low levels. So this was Alex at his initial visit. You can see he's swollen in his thyroid area. When you felt his thyroid, it was nodular and felt about 2.5 to 3 times normal size. This was Alex a mere 8 months later. Now the thyroid gland feels, you can still feel slight nodules in the thyroid gland. It has shrunk down to almost normal size. He's still got a little goiter. These are full little nodules in here, but it's coming down. He's feeling better. Mother's happy. He didn't need surgery. He didn't need radiation of his thyroid. And let's just look at the comparison of the two. It's a mere 8 months on taking iodine. And his Hashimoto's titers went away. Alex just saw me for Christmas break. He's in college now, and he's doing well in college. And he went off to college in September, and this is December when he saw me, about a month ago. And guess what Alex wasn't taking while he was in college for his fall semester? He didn't take his iodine. He gets home. His mother is not happy. She sees his neck, and he tells her he's not taking iodine. And already had an appointment with me and came in. And I read him the riot act. I checked his thyroid levels. His Hashimoto's titers were now in the 200s, and his thyroid levels were getting screwy. He was complaining of being tired, and but doing well in school. And I encouraged him to go back to taking the iodine, go back to the regimen we had him on, and I can report back to you later on that one. So Graves' disease is an autoimmune illness with the enlarged thyroid and protruding eyes that we've seen. It's more common in women and young women, and women have just given birth. This is my nurse, Denny. She was diagnosed with Graves' disease after the birth of her first son in her 20s. And she had been seeing an endocrinologist for years and years, and she kept going through these Graves episodes where she'd get hyper and her eye would get swollen, and they put her on anti-thyroid medication, anti-thyroid drugs, and she was basically on anti-thyroid medication for over a decade, and just not feeling well. No energy, and her brain's not working, and she's complaining on and off. So when I learned about iodine, I wanted Denny to be in my first studies with iodine, and the first studies with iodine were shown here. We measured we gave 6 healthy women 50 milligrams of iodine, and we drew their blood every hour. So they're shown in orange here. So you could see after they took 50 milligrams of iodine here, their iodine levels went up, peaked around 2 to 4 hours, and then they were out. By 8 hours, they're halfway down, and they're out with 24 hours. So Denny, when I did her, she took 50 milligrams of iodine here. Here was her pre-level, so she really doesn't have much iodine in her blood. Her iodine level went up to here in 1 hour, and then hour 3, she's pretty much out. So the question I would ask you all, did she absorb iodine? The answer is yes. Did she retain the iodine? The answer is no. She quickly absorbed it and got rid of it. So when we did the same test with Denny, I measured her bromide level and her urinary bromide output. And in yellow is what's considered high. And I'm sorry, this is serum levels, not urine. I shouldn't have it should be serum bromide. And here's her numbers, time 0, time 1. Now, at time 0, I should have another line up here. I don't. I should have another line up here that says this is toxic levels of bromide, which it is. So Denny's walking around with this high level of bromide in her bloodstream. Bromide is in the family of halides. I'll talk about bromide in a second. And it's unfortunately, we're exposed to bromide from food, drink, and consumer goods. And we're over-brominated and under-iodinated, and that's causing our major problems. So Denny, after she took 50 milligrams of iodine, her bromide went up appropriately, as you would expect, because the iodine displaced the bromide, and she didn't feel good. When we were doing the test in my office and I gave her the iodine, she felt awful here. And she said, my Graves is flared up, I got a headache, my eye hurts. She was not happy with me here. And we drew her blood, every hour is shown here. And by 11 hours later, this is our long day at work, she was back to where she was, but she still wasn't feeling well here, and she had all her Graves symptoms flared. So Denny, and I'm sorry, I should have had a treatment here. After this, I told Denny, you need to take iodine, you're iodine deficient. She said, I'm not going to take it. I don't feel good with it. So I diagnosed her with iodine deficiency, bromide toxicity, and oxidative damage to her thyroid just from having this excess bromide. And, so she wouldn't take iodine, but she would take salt. Now, recall that chloride, bromide, iodine, fluoride are all in the family of halides. If you take more of one, you can competitively inhibit the other. So I use salt for the chloride in it to push out the bromide. And I also put her on vitamin C as an antioxidant, and that's all I put her on. And here she is 6 months later of just taking vitamin C and salt. So here's her new curve shown in gray. Now she's absorbing the iodine more normally like these other women. She didn't have this big peak, and she's not out in 3 hours. And here's her, so her bromide, when we did this test, her bromide levels, we messed up the tubes and we couldn't test her bromide. So I don't know what her bromide was, but when she took the iodine again, she was feeling lousy in here and, had a Herxheimer reaction of sorts. And she was unhappy with me again. And she wouldn't, I told her, you need to take iodine, Denny. That's going to be part of this treatment for it. But she wanted to take iodine, but she continued to take the salt and vitamin C because she was starting to feel better. And now she was starting to have periods where she didn't need to take the anti-thyroid medications for the first time in over 10 years. So 5 years later, Denny's still feeling better with unrefined salt and vitamin C. For the first time in, it was close to 15 years now, she became euthyroid. Her TPO titers for the first time in over 15 years became, normal. And she agreed to do another loading test, finally. Here's her new loading test. We're about 7 years into studying her. 5 years, I'm sorry, into studying her. Much more normal. Here's her new bromide levels shown in red. Much closer to what normal people have. Normal people are about here, maybe 25, 30. Here's high in yellow, and toxic is up here, 200. So 2014, she's now been feeling well for 6 months. She's been on no antithyroid medications for the longest time in her life since she had kids. Kids are almost 30 years old now. And she agreed to do another loading test. Here's her newest loading test. 50 milligrams of iodine here. She's now retaining it. Symporters are coming back to life here. And here's her new bromide levels shown in, peach. So taking the vitamin C and salt and has detoxed her body from bromide. At this point, she's agreed to take iodine, and she's been taking iodine. She did have one small Graves flare in the next year and a half. That went away quickly. We upped her salt and upped her vitamin C and upped her iodine. And so when there's problems with iodine, think detox first. Support them with vitamin C, salt. They need to drink adequate amounts of water. Liver and kidney support. Definitely need to exercise and clean up their diet and get the junk out of their diet. This was a note from an ophthalmologist on a patient of mine. She was the wife of one of my medical colleagues. I went to medical school with her husband. And as those of you that treat doctors' wives and doctors' children know, they're the worst patients to treat because they always have side effects, they always have problems, and they're always odd. So when I saw Joy, Joy's husband called and asked, "Can you see my wife? She's got Graves' disease. She's not feeling good. They want to do surgery on her thyroid, and she's miserable, and therefore I'm miserable." So I see her. I do my workup. I do an iodine loading test and a spot urinary iodine, and she's very low. And I prescribe iodine for her, and as well as magnesium, as well as vitamin C, the same salt, the same thing that I showed you with Denny. I get a call from my friend, her husband. He says, "Dave, I thought iodine caused Graves' disease or made it worse. Isn't she supposed to avoid that?" I said, "Svi, she's been low on iodine all these years. I mean, she hasn't taken iodine. She's had Graves' disease. That's certainly not causing it." I said, "My testing shows she's very low in iodine. She needs the 50 milligrams, and she's going to do well." So she took it, and this note followed from her ophthalmologist. This is a little note and a follow-up on our mutual patient. I saw Joy today for follow-up. She's doing incredibly better. All of these subtle changes related to Graves' disease in the periorbital area are continuing to diminish. In fact, the lower eyelids, are tightening beautifully, and the bulging that is present that she thought was familial may in fact only have a partial familial component. I'm going to reevaluate her after the Jewish holidays, but to hold to her that if she continues to improve, surgery is not warranted and in fact could be contraindicated. So if this can work in a female wife, in a wife of a doctor, this can work in anybody. This is proof positive this stuff works. So the first double-blind cohort study in Graves' disease occurred in 1863. Dr. Armand Tussaud accidentally treated a Graves patient with iodine instead of digitalis. He thought he grabbed the digitalis bottle and he grabbed the iodine instead. He didn't know what he gave him. The patient didn't know, so that's our double-blind study right there. Patient improved, and upon realizing his mistake, he stopped the iodine and gave him digitalis, and the patient worsened. He put him back on the iodine. So this is our first double-blind study on iodine that shows that it works for Graves' disease. He used 75 to 100 milligrams of Lugol solution. Dr. Plummer in 1923, his hypothesis was that the hyperthyroidism of Graves' disease was due to iodine deficiency. Before surgery, iodine was used to control the high mortality of surgery for Graves' disease, such as thyroid storm. Plummer administered 20 to 30 drops of Lugol solution, which is 130 to 195 milligrams of iodine pre-op and 62 milligrams post-op. What he found was the mortality declined from high to 0. Let me skip this one just for time purposes. So Hashimoto's disease is an autoimmune illness where lymphocytes attack the thyroid gland, and you get thyroid antibodies. 2% of the population is reported. The number is way higher than that because no one's checking for this stuff. For those of us checking, I don't know, I would say the numbers are at least 25% of the people that I see have signs of Hashimoto's, maybe 10 to 25% have signs of Hashimoto's, and it's more common in women. TPO antibodies are found in 10% of women in early pregnancy. They're associated with decreased thyroid functional reserve during gestation and associated with hypothyroidism. And TPO antibodies are also associated with a 50% increased risk of postpartum thyroiditis. The presence of TPO antibodies at 32 weeks has resulted in a significant IQ decrease in children, even when mothers were euthyroid. This needs to be treated before the moms become pregnant. Now, thyroid antibodies are only formed when there's oxidative damage to the thyroid. I showed you how that forms. Parvo B19 has been detected in Hashimoto's patients, in a significant amount of Hashimoto's patients. I check my patients for parvo antibodies, and we find parvo infections in our patients that way. Dr. Hashimoto in 1912 described what Hashimoto's was. I'm not going to read it. I mean, he called it struma lymphomatosa, and it wasn't observed in the U.S. at that time in 1912. And that was before iodized salt. We did not have Hashimoto's. So the Mayo Clinic did a study, and they found that the signs of Hashimoto's from 1915 to 1920, before iodized salt, wasn't there when they went back and looked at pathology slides during that time. And they emphasize here in the bottom that Hashimoto's disease was only seen after the introduction of iodized salt in 1924. Another study from the Mayo Clinic, 3-time period study, right after iodized salt, a little bit further, and a little bit further after. And what they found was Hashimoto's went up. This is where the whole iodine causes Hashimoto's came into play, because people started looking at these studies and saying, hey, it's iodine causing this. Look, this is after iodized salt. But remember, association does not equal causation. So why does Hashimoto's form? Could it be iodine? The NHANE study shows that that's not true. Iodine levels have been falling for the last 40 years. Hashimoto's has been going up. If iodine was causing it, we would see the opposite occur. Could it be salt? Or could it be a goitrogen, such as bromide, chloride, or fluoride causing that? Well, or is it a combination of iodized salt and goitrogen, which is exactly what's happening, in today's world. These goitrogens that we're so exposed to in our environment are setting the stage for oxidative damage to the thyroid. So it can't be iodine based on these numbers from the NHANE study. Iodine levels have fallen all at the same time that Hashimoto's disease has increased at epidemic rates. It's impossible to experimentally induce Hashimoto's disease in lab animals by administering iodine. Only by the use of antithyroid drugs, such as goitrogens, can you induce Hashimoto's disease in laboratory animals. Goitrogens induce not only hyperplasia, they cause iodine deficiency. So what's the mechanism for thyroiditis? We already went through it. It's oxidative damage to the thyroid molecule caused by low levels of iodine combined with goitrogens. So you can get this from chlorinated products, bromide, fluoride, the halides in excess, and it activates TPO. We already went through the mechanism. I won't read it again. So the treatment is magnesium, iodine, vitamin C, and selenium have been shown to reverse this mechanism, particularly iodine in there. Selenium has been shown in studies to reduce antibodies in those that are deficient in selenium. But not everyone's deficient in selenium. This is a very variable treatment. I do use selenium when they're low, but I don't put everyone on selenium. In contrast, I put almost everybody or nearly everybody on iodine. So the conventional approach to treating autoimmune thyroid conditions are to use beta blockers and PTU just to control the symptoms, PTU to take out iodine in the body, and they rely on radioactive iodine to destroy the thyroid cells. Hippocrates said, give no deadly medicine to anyone. 10 to 32% of radioactive iodine injected into someone is supposed to be uptake by the thyroid. That's reported as normal. This number in itself shows the whole population is iodine deficient because it should be zero. You have enough iodine in your thyroid, radioactive iodine should pass right through. Well, that means if they're giving 10 to 32% radioactive iodine going to the thyroid, where does the other 68 to 90% go to? It's extrathyroidal. And this is where it goes, wherever there's iodine binding to. So what tissues are going to be damaged and possibly you damage the DNA and causing worse problems. All the glandular tissues. What are we having problems with? The fastest growing cancer in the United States, thyroid cancer. 1 in 7 women with breast cancer. 1 in 3 men with prostate cancer. Got a mess on our hands. Why would we use radioactive iodine? In Werner and Ingbar's of Thyroid, it says radioactive iodine is effective, safe, and relatively inexpensive. That's only if the goal is to destroy the thyroid, then it's effective, but that's only if the cause of autoimmune thyroid disorders is too much thyroid tissue that needs to be destroyed. That's ridiculous. It's not excess thyroid tissue that's causing it, it's the consequence of the illness. Radioactive iodine is not improved the outcome of patients with papillary thyroid cancer managed by near total thyroidectomy and conservative nodal excision. There's really no reason to use radioactive iodine in anybody. I have not recommended its use in 12 years once I started using iodine in these milligram doses. Radioactive iodine will bind to all tissues where iodine is bound to, and especially the glandular tissue, which concentrates iodine, because you can't make any hormones without iodine. All the glandular tissue, breast, prostate, ovaries, adrenals, testes, all the glandular tissue, pancreas, all those tissues of the body, concentrating, utilize iodine, and we're suffering from cancer. Epidemically increases of cancer in all the glandular tissue, thyroid, ovaries, uterus, breast, prostate, pancreas. 6,800 patients with thyroid cancer received an average dose of iodine, radioactive iodine shown there, and what they found, a dose-dependent increase in cancer of salivary gland, bone, soft tissue, and colorectum, an increased risk of primary malignancy of any type of 27%. These are cancer mortalities after well-differentiated thyroid cancer treated with radioactive iodine, going up in nearly every category. The cost of radioactive iodine is shown here. Iodine costs about 50 cents per day or less. So, radioactive iodine only works when people are iodine deficient, because if you have enough iodine, it's going to pass right through you. And bakery products used to contain iodine, and around 1870 they were removed. The question is why? Why would you use radioactive iodine if it doesn't treat the underlying cause of any illness? If it doesn't treat the underlying cause of any illness, then why should it be the primary treatment modality used? So how do you prevent radioactive iodine from damaging the thyroid? You're going to ingest enough iodine to maintain iodine sufficiency, and therefore maintain maximal suppression of radioactive iodine uptake by the thyroid gland. And it did it again. How much iodine is needed to achieve this? It's shown by Dr. Abraham's graph. You want to maximize iodine intake into the glands. You want to minimize radioactive iodine uptake by the thyroid, and it's going to be right here, from 10, somewhere around, at least 10 milligrams, maybe 100 milligrams, maybe even more of iodine per day. So the holistic approach to treating autoimmune thyroid disorders is clean up the diet, especially make them gluten-free. I would throw dairy-free into here as well, because I've seen improvements with that. So correct vitamin and mineral deficiencies. Magnesium and vitamin C are incredibly important here. Balance the hormonal system with natural hormones. I use desiccated thyroid hormone when I need thyroid hormone. Treat their underlying infections, such as parvo or mycoplasma or chlamydia or something. Rectify an underlying iodine deficiency, and detoxify their body. That's the way to treat the underlying cause of their illness. This is Tracy. She just had her baby 3 months ago. She goes to her doctor. She's not thinking clearly. She's brain's turned to mush, and she's got this TSH of 175. So the doctor, like any conventional doctor, puts her on Synthroid. And I'm sorry, let me go back. You can see her face is all puffed out here, and she's starting to lose her eyebrows on the outer third. She's got this TSH, so he puts her on Synthroid. He makes her euthyroid. Does she look any better here? No, she looks worse. She's puffier here. Her brain's still not working. She's still complaining of the same thing. And her doctor says, well, it's not your thyroid. You're just depressed. Let me give you some Prozac, which she didn't want to do. At that point, she got annoyed with him. She read my book on iodine and made an appointment, came to see me. She was diagnosed with Graves' disease at that first visit, too. And I did an iodine loading test and a spot iodine, which she was very low on. I did my workup on her of, checking for nutritional and hormonal imbalances. And I put her on, just magnesium. Well, you'll see what I put her on. I changed her over to desiccated thyroid. I put her on little magnesium. I put her on 50 milligrams of iodine and a teaspoon of salt a day of unrefined salt a day. And this is another N of 1 where iodine was part of that treatment regimen for Graves' disease. And here was desiccated thyroid as part of that regimen. So for a hypothesis to be proven true, it has to withstand all criticisms. Iodine does not cause or worsen autoimmune thyroid disease in these patients that I'm showing you here. Iodine deficiency in the thyroid gland was known to be related to goiter, which was first described over 100 years ago. And it's shown here for all the iodine deficiency can cause all these problems. All of these conditions have been rising at epidemic levels over the last 40 years while iodine levels have been falling. That's a negative association that disproves iodine causing all these problems. Holistic approach we went through, I won't go through that again based on time. So iodine, the adverse effects of taking iodine, yes, you can cause hyperthyroidism if they have a hyperfunctioning autonomous nodule. The iodine will be taken up by that nodule and make lots of thyroid hormone. That's the rub of giving someone iodine who has nodules. This is a very rare possibility. Between my partners and I, we've had about a dozen patients over 12 years of use where this happened. In this case, these people can't take iodine until they get that nodule removed through some way. Surgical is what I recommend. It is not common, but this can happen. These are the people you give them iodine, they become hyperthyroid within the first dose or two. However, medical iodophobia is the unwarranted fear of using and recommending inorganic non-radioactive iodine within the range known from the collective experience of 3 generations of clinicians to be the safest and most effective amounts for treating the symptoms and signs of iodine deficiency from 12 to 50 milligrams per day. That famous quote is from my mentor in iodine, Dr. Abraham. And unfortunately, that is still prevalent today because people are just parroting around that iodine causes Hashimoto's or worsens it when it doesn't, when it's used appropriately. So hopefully I pronounce you all cured of that medical iodophobia and willing to learn more and to start using iodine for your patients. So let me leave you with some final thoughts that iodine levels have been falling over 50% over the last 40 years. During this time, elevations in autoimmune thyroid disorders and thyroid cancer and breast cancer and prostate cancer as well as other endocrine cancers have occurred. If iodine were dangerous for the above conditions, the incidences of these conditions would not be rising over the last 30 years. So if you're going to use iodine, start slow, check people pre and post, follow your patients, get ultrasounds before starting treatment, if you palpate something, but combine it with a holistic treatment plan of diet, vitamins, minerals, and detox. We get wonderful results in our practice, and you can too. So use a combination of iodine and iodide, and I use Lugol solution or tableted Lugol solution in somewhere in doses of generally 12 to 50 milligrams per day. St. Georgie, the discoverer of vitamin C, said, discovery consists in seeing what everybody else is seeing and thinking what nobody has thought. That's why we're here today. And there's a lot of science behind iodine. Unfortunately, there's a lot of myths behind it as well. And you just have to plow through it to figure out the truth of it. So I want to end there, and I will take questions, from anyone has any questions, and I thank you for listening.
Thank you. Thank you. That was wonderful. There are many questions. So I can either read them, or if you're able to access your control panel, I will just keep them coming until you're done. We've had a number of people ask about the method that you use to assess iodine status. Can you speak to that?
So there's 2 major ways you could check iodine. One is with a spot urinary iodine, where you just pee in a cup and they measure how much iodine's in there. That test is only a valid test if they have not taken iodine, because we don't have reference ranges for spot urinary iodines once you're taking iodine. The other way is an iodine loading test, where they take 50 milligrams of iodine at time 0. They collect 24 hours of urine after the 50 milligrams. I'm sorry. They collect 24 hours of urine after taking the 50 milligrams, and then they send that urine, a sample of that urine, into a lab. The lab reports back how much iodine excreted out. And because we know the renal clearance of iodine, and we can figure out how much is in and out by just subtracting the numbers. And through some research that I did with Dr. Abraham and some other colleagues, we found that about 90% excretion of that 50 milligrams. So when 45 milligrams comes out, the body retains 5 milligrams in a pool. That's about normal. So when people are lower than that, they need more iodine. So those are the two primary testing methods that I'm using. For thyroid tests, I just do Quest thyroid testing, Quest blood tests.
Okay, great. Lakshmi asks, how do you calculate supplementation?
Well, I just showed you how I calculate it. And you have to use enough iodine to get the molar concentration up so you can produce iodinated lipids. So that's somewhere around 50 milligrams for most people, and it's not going to be micrograms. So that's how I calculate it. Generally, if they're sicker, they're going to need a little bit more iodine, and if their iodine loading test is lower, they'll need more iodine.
Okay. Do you cover that in detail in any of your books?
Yes, I cover it in my iodine book. Exactly.
Okay. So buy that, everyone. Be an incredible resource. Another question from Jason. Are blood levels of selenium, iodine, etc. reliable to indicate a deficiency, or do they fluctuate widely?
Well, we don't. There are reference ranges for spot blood iodine levels, but again, there's only so much information you can get from that if they're not taking iodine. Once they're taking iodine, we have no reference ranges for that. So selenium levels, I do RBC selenium testing as well as hair testing, and I use them both to figure out if there's a selenium deficiency. Selenium, that's the best way I think you're going to be able to test the levels.
Okay, great. We also had a number of questions about treating pregnant women.
Well, if pregnant women don't have enough iodine for their babies will have a lowered IQ. I have a whole lecture on that. And pregnant women need iodine to make thyroid hormone just like non-pregnant women. So it's important for women to get their iodine status rectified before they become pregnant, because once they're iodine deficient during pregnancy, these babies' thyroids and the other endocrine glands aren't going to form as normally as they should. And I think that's what's leading to all the health problems we're seeing in generation after generation now.
So perhaps that's another webinar later on. And Judy asks, when iodine is replaced, do you see AB come into normal range?
Yes, in about 50% of people, their antibodies become non-detectable or lowered, lowered below reference ranges where they should be. In the other 50% of people, their antibody titers will decrease in half. Most of them will decrease in half, and they'll just get stuck there. So they'll still have signs of antibodies, and they won't fully go away, but they're feeling better, and they're lower than where they were. That's been my experience with it, and my partners are, would, I'm sure, verify that same experience.
Okay, thank you. What do you do about iodine dose after you have cured autoimmune disease of thyroid?
The body doesn't really have stores of iodine, and it will use up its stores very quickly if iodine is not continually ingested, so they need to keep taking it. And in the world we live in, with the toxic levels of bromide and fluoride out there, those halogens that are competitively inhibiting iodine and causing all the oxidative damage, they're going to need to take iodine. Our iodine requirements have gone up over the years, not gone down, because of the toxicity of our world that we live in.
Okay. And factors of that, would that be fluoride in the water and pesticides?
So there's fluoride and pesticides in the water. There's fluoride in a bunch of drugs such as Prozac and quinolones. There's bromide in food and drink and as a fire retardant in mattresses and carpets and desk, and I have whole lectures on that as well. Absolutely, okay. We're exposed to just tremendous amounts of those toxic halogens.
Yes, we are. Okay, thank you. Jason asks, Searching in PubMed yields several articles and papers on iodine often worsening Hashimoto's. Do you have any insight into these papers? Is an initial worsening of symptoms expected, or should iodine be abandoned in patients who initially worsen? And I think you spoke to that some.
Jason, I went through one of those papers and showed you how they misrepresented that paper, and that's how they misrepresent all the papers. I mean, there are different ways they do it, but because TSH goes up does not mean you're worsening thyroid problems in these patients, and really that's what they focus on nearly all these papers.
Okay, thank you. And the recording of this, again, will be sent to the email that you used to register, and we will also have it up on the blog at powertopractice.com. 2 is the number 2. Okay, next question. From Angela, would you still recommend iodine supplementation for someone who has hypothyroidism without antibodies?
Well, do they have skin? Because 20% of the body's iodine is in the skin. Do they have breasts? The breasts have around 5 milligrams of iodine in an average-sized woman. Every gland, every cell, every tissue needs iodine. Absolutely, they need iodine, whether they have hypothyroidism or not.
Next question. I didn't catch the name. How much salt did you use to treat Denny?
1 teaspoon of unrefined salt a day, and it's about 10 grams.
Thank you.
That's about what I put most of my patients on.
One about the Lugol solution. You answered that. What is the relationship between the thyroid gland and epidermal growth factor?
I don't know.
All right. Do you also see Hashimoto's in patients with high EVB antibodies?
Sometimes. I see them high chlamydia antibodies, mycoplasma antibodies, parvo antibodies. It can be different infections, but you know, the good thing about iodine is it's a universal antiviral, antibacterial, antiparasitic, anti-candida agent.
Okay. And here's one on parvovirus. How do you treat people for parvovirus? Someone asks. High vitamin C?
I use vitamin C. I use iodine. And try and get their immune system better and clean up their diet. And usually you'll see the antibodies flip from IgM to chronic IgG. Just that they've had a past exposure.
Okay. Pat asks, I'm confused. It seems you are using salt for treatment while stating that excess salt is part of the cause of iodine deficiency. Please explain.
Now that one slide shows that Hashimoto's went up after iodized salt. So I was drawing the inference of the question, is Hashimoto's occurring because of iodine and iodized salt? And then I asked the question, is it caused by salt? No. I meant that I was trying to dispel the myth that iodized salt was causing the rise in Hashimoto's over those time periods, that it couldn't be iodine. And you do need a little iodine for Hashimoto's disease. You can't have very low iodine, or you can't get any oxidative, you won't have any thyroid hormone being produced, or you won't even have anyone alive. But that's what I meant by that.
Okay. Another question. Can you share what is the optimal labs, in parentheses, TPO, TG, antibody, iodine, etc.? Lots of lab test questions.
I use reference ranges by Quest, and as far as antibodies, I don't, you're not going to get antibodies to 0 in a lot of people, but you'll get them below those reference ranges. So I use the Quest reference ranges for all that stuff.
Okay. And Quest Labs, we have another one about the specific lab that you use.
Quest Labs is in our office, and we utilize them.
Great. And with Power to Practice, the members who use Power to Practice also get many significant discounts on Quest Labs through our group purchasing agreements with Provista. Just by the way, last I saw was about 40% savings. Okay, another one. Does an ultrasound differentiate an autonomous nodule?
No, it just shows a nodule. So you don't know if it's hypo or hyperfunctioning, and you got to do specialized tests for that. But, you'll know it's hyperfunctioning if you give them iodine and become hyper within the first dose or two.
Okay. What is your view on LD and use in Hashimoto's?
I find that LDN, in those that it helps, LDN is a really neat treatment. It really does, work along with this other stuff. The problem, in my experience, is it works, I don't know, maybe 1 out of 100 people. You can treat 100 people with LDN, and I don't know, a couple might be helped with it. Vast majority are not helped with it. That's been my experience with it.
Okay, thank you. Follow up on an earlier question. So it's not worth replacing iodine in pregnancy?
I didn't say that. Pregnant women need iodine, and they probably need it more because they got a fetus in there that's trying to get enough iodine and form the glands and the neurologic tissue normally. They need iodine just like anybody else. They probably need it more.
Yes, thank you. And is there any value at all in serum iodine testing?
You can do a spot serum iodine testing. No, I would say no. You can do a spot serum iodine testing, and you'll see low levels if they're not taking iodine, but once they're taking it, it's an irrelevant test, and you're going to get a high level on the chart if they're taking it, so don't do that. It's just not good medical legally, even though nobody understands iodine, but you don't need to see a high level with it if they're taking iodine. So I would stick with the urinary iodine. Only do the spot testing if they're not taking iodine. Once they're taking it or you're prescribing it, the only test you have available is the iodine loading test. I describe that in my book. And by the way, for salt, if you want more info on salt, I have a book on salt, Salt Your Way to Health.
Oh, yes. And those can be accessed on your website or Amazon?
They're on my website. Okay. We got mad at Amazon years ago. So they're on my website, drbrownstein.com.
Great, thank you. Okay, do you have time for a couple more questions?
Yep.
Okay, great. Can low iodine cause difficulty with conception?
Absolutely. That's been written about in the literature. I can't tell you how many patients, because you're gonna when you correct low iodine, the thyroid gets better, the ovaries get better, the testes get better, the whole endocrine system gets better, and miraculously infertility can go away with iodine as part of that regimen.
Okay. Do you do ultrasounds of everyone to evaluate for nodules before giving iodine?
No, only if I palpate nodules that I think are sufficient in size do I do an ultrasound.
Okay, thank you. You said your daughter was cured, but she was still on thyroid hormone. If there's no more attack, why does she still need to be on it?
Because she's hypothyroid without it, and she's symptomatic without it, and she feels better as we follow that TSH and the thyroid levels, as they drift to the lower side, and we increase it with a little thyroid hormone. She's got Hashimoto's and hypothyroidism.
Okay.
Yes, she was cured of Hashimoto's.
Uh-huh. Do you believe one can get enough iodine using sea vegetables?
No. Not in today's world with our bromide and fluoride exposure. There's just not enough in them. And keep in mind, the sea vegetables have the same symporter that we have. These symporters, if the symporters are overloaded with toxic halides like bromide and fluoride, they'll move bromide and fluoride into those cells instead of iodine because there's no iodine available. So so you can actually get bromide and fluoride toxicity from sea vegetables depending on where they're grown in the ocean. I've tested varying amounts of seaweed or different batches from different companies, and the iodine and bromide content shifted dramatically. I just stopped testing it because it was funky numbers with different batches. And it's not enough in today's world.
Have you written about that?
I've written about it in my newsletter. I haven't. I think that's in my book. I don't remember if it's in my book.
I would love to republish that blog through our newsletter if we could.
Of course you can. You guys have all my blogs, or you have access to all.
Wonderful. Wonderful. Another question. Is it best to measure bromide and fluoride in urine or in blood?
Urine. Well, fluoride is not so easy to measure because it's such an electronegative molecule. It's highly reactive. The body does not like it floating around and binds it up into bone and teeth, hard tissues of the body. So Dr. Abraham and I tried to measure fluoride levels, fluoride displacement by giving iodine. We could never get it. We couldn't get it. You'll see it in my book because I have the study in there, but we couldn't get the fluoride to come out. The bromide, which the size of bromide and the molecular weight of bromide is much closer to iodine. We could get that displaced with iodine. We couldn't get bromide displaced. Fluoride is too small. The molecular weight is small, much smaller than iodine and bromide. So fluoride, I'm just going on a hypothesis that, that's there as well, although I don't really have good data to back that one up, but, I'm saying it anyways.
Okay. Another question, do you think healthy, regular swimmers need iodine supplements?
Good question. Yes, and they need more iodine because they're in that brominated or chlorinated water all the time. They're going to need a little bit more iodine. And I got this kid, he's not a kid, he's a college student now. He swims in college, and he was getting sick all the time. And I've been treating the whole family, and he required more iodine than the rest of his family because he was swimming all the time. So yes, swimmers need more iodine.
Yeah, very good question. Another one, how would you treat a patient who cannot take a desiccated iodine, such as religious reasons or vegan?
Well, they treat them with Synthroid. Interestingly, so I've been doing holistic medicine for a little over 20 years. First, give or take, I'm gonna just round off these numbers a little bit. But the first 10 years of my practice, I didn't know about iodine. I was treating people with thyroid. I was diagnosing thyroid problems and treating them with desiccated thyroid hormone when I thought they had hypothyroidism, and patients were getting better. The next 10 years, I learned about iodine from Dr. Abraham and started really using iodine as part of that regimen as well. What I found were two startling things. Number one, my use of thyroid hormone, which I'm estimating that I probably had 3/4 of my patients in the first 10 years on thyroid hormone. The next 10 years and up to now, I probably have 1/4 of my patients on thyroid hormones. So I went down in half from how much thyroid hormone I was using. The other startling thing I found was there was no question in my mind in the first 10 years that desiccated thyroid hormone worked better than Synthroid, the levothyroxine products, T4 products. No question. I mean, I saw it on a daily basis. And once I started using iodine, I didn't see that. People did well whether they used levothyroxine or they used desiccated thyroid hormone. So I don't make a big a stink about it now as I used to. So the answer to the question is put them on levothyroxine. If you get the iodine right, I don't think it's going to matter what thyroid hormone you put them on.
Okay, great.
Hopefully I answered that one. Did I answer that one? I may have to move on. That's fine.
Sounds good. I think you did. We've got a few more. You talked about other autoimmune diseases and iodine. Any insights to share?
Absolutely. I find autoimmune disorders much easier to treat, all of them, when their iodine levels are appropriately treated. And, out of everything I do in my practice, and 20 plus years of reading and writing and going to conferences and trying different things on patients, the single most exciting thing that I do is correct somebody's iodine deficiency. There's no doubt about it. And that includes other autoimmune disorders as well. Biggest bang for the buck is iodine.
Wonderful. We have a question about chelation for bromide toxicity. What are your thoughts?
Well, I don't know how you chelate bromide, but I know how you competitively inhibit bromide and use iodine and salt as part of that regimen. That was the old treatment for bromide toxicity, because bromide toxicity was more common over 50 years ago when a lot of commonly over-the-counter medications like bromoseltzer were available. People would get bromide toxic. So the treatment for bromide toxicity in medicine, back in the day, was IV normal saline and salt. And the treatment now, I would say, iodine should be part of that treatment.
All right. Another question about the MTHFR gene mutation affected methylation and association with autoimmune thyroid. Then would you do anything different for their treatment?
No,
So what do you think about that and then treatment?
I wouldn't do anything different. That's what I think about that. I'm treating them the
Okay.
same way.
Do you think that there's a connection between the methylation and autoimmune thyroid?
No.
Okay. Can we reduce the amount of thyroid hormone if we use iodine?
Another good question. Yes. So the first 10 years of my practice, I have 3/4 of my patients on thyroid hormone. Now I have 1/4 of them. I've clearly reduced, and my average dose 20 years ago was 1.5 grams of desiccated thyroid. Now my average dose is 0.5 gram. Absolutely. So if someone's, I call it the rule of thirds. When you put them on thyroid hormone, they're already taking iodine. I'm sorry. You put them on iodine and they're already taking thyroid hormone. 1/3 won't need thyroid hormone. 1/3 will need half the thyroid dose, and 1/3 will stay the same. The problem is I don't know who those thirds are when I start it. So I just tell patients, if you get hyper, just start lowering your thyroid down. And most people can lower the thyroid down at least in half, and 1/3 can come off it when they start iodine.
Oh, fantastic, thank you. A moment ago, you asked if you had effectively answered someone's question. She said yes, so thank you. I've got one more. Sounds like a patient question. She says, I have Hashimoto's. I stopped taking my iodine. I think I will take it again. What I have is Iosol, and it says 1,830 micrograms per drop. How many drops should I be taking a day? I was doing
Well,
2 drops a day. Is that correct? Please let
and
me
that's
know. I'd like to take it again.
that sounds like a milligram a drop. So I'm talking doses of, for most patients with Hashimoto's disease, 25 to 50 milligrams. So that's going to be a lot of drops, 25 to 50 drops, if I'm doing the math right in my head. Um, it's easier to move to something like Lugol solution or tablet of Lugol's, which is 6.25 milligrams per drop.
Okay, thank you. We have a few more if you are still good to go for another 5 minutes or so.
Go for it.
Okay, thank you. Are there any contraindications for iodine?
If you have an autonomously functioning nodule, that's the contraindication for it. That's it. And I went over that. That's where they take iodine, they get hyperthyroid right away.
Okay. Ooh, I like this one. Any improvement in dementia with iodine?
Yes, no question. And if you can catch someone early in the course of that, yes, they can, pretty much come back to a normal span. But look, I see people all the time with brain fog and varying degrees of brain complaints. And boy, when you get their iodine better, it's one of the first things they'll notice. They become sharper mentally.
Yes. Oh, yes. Do you have a most common list of medications that are commonly used in primary care that cause iodine deficiency, like SSRIs?
Well, the list is bromide and fluoridated compounds. I mentioned a few of them, the quinolones. Oh, my brain's getting tired from, the end of the day. Well, come on. Um,
That's
I
okay.
can't, I can't
Hey,
come up
we
with them
can
right
get
now.
your question.
I do list them in my book. I have a list of a lot of the drugs that contain bromide and fluoride in there.
Wonderful. And this person says, I have seen isolated low-level TPO antibodies. What is your insight
Well,
connected to the medication question?
there's no question that TPO will start to rise when there's oxidative damage going on in the thyroid. Remember, if it's going on the thyroid, it's probably going on the breast, it's probably going on the ovaries, it's probably going on the pancreas. I gave you the mechanism of how it happens, and I gave you the treatment of mechanism of how it happens. And iodine and salts and vitamin C, should be part of that treatment regimen.
Okay, thank you. Someone asked again about the lab company that you use. I believe you said Quest Labs.
I primarily use Quest for most of my labs, and for the loading test, Quest doesn't do that. I use Hakala Labs or Doctor's Data for the loading tests. Quest will do a
Okay.
spot. Quest or LabCorp will both do spot iodine testing fine.
We had a couple of people also chime in with those medications. So Prozac was one, nasal spray as well. Fluorinated topical steroids. That's a
Yep.
question. Yes, yes.
Yeah.
Okay. Hey, that does it. We're going to wrap it up. Thank you so much. So much.
Thank you, Linda. That was fun.
Yes, can't wait to have you back. Everyone out there, you can find the recording on the blog at power2practice.com. Thank you and have a wonderful night.